No, for sure. So, doctor, you have conversed with head and neck surgeons.
Yes.
You have conversed with different doctors of different specializations. So, if you can go one by one, what kind of questions do you typically face when a surgeon speaks to you about this, or when a general physician speaks to you about this? What are the typical? You don't have to be specific.
Rahul, in any part of practice, any change is very difficult. The change to bring something new in their existing system of protocol, something introduction of new thing is initially very hard. Once they know that this is beneficial to patient, then it will go to the spinal level and all patients will start to come. But initially, since this is the scenario, most of the surgeons are hell-bent on having whatever their practice is. They ask me, what's wrong if I do biopsies? Anyway, when you are doing DNA ICM, I have to do biopsy later on. But let me tell the surgeon that the biopsy site might be wrong. When you see a white patch in the mouth and you take a biopsy from the area, that may not be the area which is actually cancerous, which can be seen by the well scope, and you can see them. And when the well scope findings are added with the DNA ICM, you're more sure that this is a particular area that should be biopsied, and the accuracy or the sensitivity will go very high. So the blind technique of biopsying all lesions which are red, white or black is not essential. There are so many lesions in the oral cavity which are white looking but not cancerous, like lichen planus. There are simple stomatitis cases where because of the cheek biting it becomes red, but it's not cancerous. So subjecting all patients for biopsy may not be a good practice, and you can save the patient's pain and the operative thing by doing well scope and cytology associated with it. So that is what the questions surgeons were asking me. As opposed to that, the gynecologists are very open. They say that anyway we are taking pap smear and we are doing HPV testing, DNA ICM is more accurate, so they are ready to comply for this, because the females, the procedure is just the same. And general physicians are, they are open for this. So they are ready to send their patients